Welcome to Dr. America. I am your host, Dr. Sanjeev Sriram, here on the We Act Radio Network. Thank you for coming back. Thanks for joining us. So this is going to be our second part of our series on the war on the poor, Dr. America versus the war on the poor. And in our first part, we kind of covered how the poor are being targeted in the budget policies that are that have been passed in the House and are being worked on in the Senate. And we've covered how these programs assist poor people, but are being attacked in the budget through cuts and slashes, deep cuts that really have no justification besides ideological misunderstandings about what the value is of these programs. Medicaid, food stamps, housing programs. These programs keep millions of Americans just above the poverty line. And for people who are below that poverty line, these programs are doing a really hard job of keeping of helping Americans just get by. And that too, just get by barely enough. So on today's segment, what we're going to do is we're going to talk about where, we're seeing another attack on the poor. And that is with minimum wage. With this attack, we're kind of actually seeing it on two fronts. We're seeing it on the government side, where there hasn't really been much of a change in the federal minimum wage. And we're also seeing it on the corporate side, where corporations that don't really have to wait for the government to tell them to raise their wages are resisting change. And, again, some of you might be wondering, well, what does this have to do with health? And actually, it's funny that you should ask that question, because just last year in California, State Senator Mark Leno, proposed a bill to raise that state's minimum wage from $8 an hour to $13 an hour by 2017. And a group that decided to do a public health assessment, this group is called Human Impact Partners. They conducted what's called a rapid health analysis of Leno's proposed Senate bill 935. This is the bill that would raise the wage from $8 an hour to $13 an hour by 2017. And the study was done in 2014. And what they found was that raising the minimum wage to $13 an hour by 2017 would actually have the effect of, get this, helping out and preventing 400 low-income Californians from dying prematurely every year. Again, that's 400 low-income Californians every year would not be dying prematurely if we increase the minimum wage to $13 an hour. That's huge. That's a big deal. And so, and then like that, the people at Human Impact Partners actually showed a ton of other health benefits of increasing minimum wage. And we're going to post that study up on the Dr. America Facebook page, and I'll tweet it because it's really worth going over the data and the numbers and just like marveling at how big of a public health intervention raising the minimum wage would be. So, it's not just economic policy. It's not just business policy. This is health policy. And so, and we're already finding that, this is a big concern to, millions of Americans. We talked about this on last week's program about Fight for 15. And, there are fast food service workers who have been protesting, their corporate overlords to extend dignified livelihoods to their families. And so, this is actually something that is pretty important in the news right now. It's one of the few fronts on the war on the poor that is actually in the streets. And so it's important to take some time to make sense of a lot of this because, as I was saying before, we have the opportunity to actually save lives here by raising the minimum wage. Just to kind of go through a couple of the other public health benefits that, did come up in that study is that they found that, that fewer Americans or fewer Californians with a higher wage were going to be suffering of depression. Fewer of them would take up the habit of smoking. Fewer of them would have problems with obesity and obesity-related health outcomes. So you can see that raising the minimum wage actually has this trickle-out effect. It's one of those drops where, that ripple kind of starts to build and build. Now, it doesn't necessarily mean that by putting money in one individual's pocket that it's going to be this magic wish that like a genie came along and, uplifted their health. But what it does show is that when you are able to extend this dignity to these communities, they're now being empowered to take those choices, to make better choices for themselves, and might endure less stress when it comes to facing that end of the month that, nearly everybody making minimum wage faces. So, there's something here that, I feel that the members of Congress, the members of state legislatures really need to pay attention to. But perhaps more importantly, I would say that maybe we need to ask our corporations to take a look at this also, because they don't necessarily have to wait for any state legislature or the federal government to do the right thing by the thousands that they employ. So to help us make sense of this, I'm really excited about the guest that we're going to be having on today's program, Ms. Rebecca Valles. She's, a real strong expert on issues surrounding poverty, and she is the director of policy for the Poverty to Prosperity program at the Center for American Progress. She has played a leading role in anti-poverty policy development and analysis, with a special focus on strengthening the country's income security programs. And before joining the Center for American Progress, she actually did a lot of face-to-face legal work directly with low-income and poor-income individuals to give them legal support. So this is somebody who doesn't just talk the talk, she walks the walk. Really excited to have Rebecca on the program. And Ms. Rebecca Valles, are you there?
Thanks so much for having me on.
Hi. Okay, so thanks for joining us. I'm really excited to have you on the program. And, I wanted to sort of start off with some clarification of terminology. And that is what's the difference between the minimum wage and a living wage, and why does that difference matter?
Well, it's a great question and probably a really good place to start. So the federal minimum wage, which I should say last increased 5 years ago in 2009, is $7.25 an hour in the U.S. And the minimum wage legally is the lowest wage that an employer can pay a worker, just as long as there aren't any exemptions, and I won't get into that right now, that the worker qualifies for. It's established by law, but it's really not based on any particular standard of living. A very similar concept that probably needs to get talked about and distinguished from the minimum wage is a living wage. Now, the idea of a living wage is it's not a law. It's a concept, and it's really kind of based on the idea of what does a worker need in order to meet his or her needs that we consider to be basic. So things like shelter and food and clothing and transportation, etc. And obviously that can differ tremendously geographically. What constitutes a living wage in New York City is very different than maybe what it takes to have a living wage in somewhere in Appalachia. But there's broad consensus that the minimum wage in the United States really falls far below what would be a living wage.
Okay, and I'm glad that you're bringing up this geographic distance, because this actually does kind of play into the differences between the standards for minimum wage set by the federal government versus state government. So, are there differences in the quality of living for the working poor when they live in different states?
Absolutely. And since we've seen the federal government allow the federal minimum wage to become eroded by inflation over the years, we've seen states and also an increasing number of local governments actually take action on their own. We saw 29 states and D.C. set their minimum wage above the federal $7.25 an hour as of January 1st, 2015. And we've actually seen a number of states, it's 15 states plus D.C., index their minimum wages to rise automatically with the cost of living. And we have a tremendous amount of research that really tells us that having a higher minimum wage is associated with higher quality of life and a higher standard of living for workers. So the landmark research is by a researcher named Erin Dubé at the University of Massachusetts Amherst, and that research finds that minimum wage increases have led to really tremendous increases in family income, decreases in poverty rates, and that's what it's about. And I should say, kind of a more recent piece of research that has really shown us the power of increasing the minimum wage is our friends at the Economic Policy Institute, EPI, took a look at the minimum wage increases that took place in January of 2014, because we now have enough data to look back at that, and they found that because of those minimum wage increases at the state level in January of 2014, workers in the bottom 10% of United States workers were the only ones to see their real hourly wages not fall between 2013 and 2014. So to get out of the kind of wonky analysis that helps us make these conclusions, the gist is that raising the minimum wage really does have a measurable impact on standard of living.
And and then I guess on top of all of the federal and state is that actually city government is starting to pay attention to this too, right?
That's exactly right. We've seen a tremendous flurry of activity at the city level, and in particular, I think folks are probably familiar with Seattle, which is phasing in a $15 minimum wage over 3 years as we speak.
Okay, and so I guess one of my follow-up questions to this to some of these balances between how much of this is federal, how much of this is state, how much of this is city. Can't large corporations just raise their minimum wage or their entry-level wages on their own? Do they really need the help of federal and state government to do that?
Well, I would argue that the federal government has a really strong role to play, and that individual states, it's good that we're seeing them step in when the federal government fails to act, and it's good to see actually a recent pattern of large employers such as Walmart and Target, which are just huge employers of low-wage workers, actually, on their own initiative raise their own minimum wages. But we really need to be honest that we can't rely as a nation on corporations to really behave in the right or the responsible way towards how much they pay their employees. Now, we've seen, some companies like Costco, which have really made a point over the years of paying above market wages in its sector, do the right thing. And in the process, it benefits from workers' higher productivity, from greater morale, and reduced turnover, which we can get into if you want. But Costco is really the exception rather than the rule. Mm-hmm. And I should add, there actually is a reason that the federal government acting is something that employers actually really like. Low-wage paying corporations actually happen to prefer changes to the legal minimum wage instead of acting unilaterally and on their own, because it levels the playing field. It means that their competitors have to pay higher wages too. And so when the minimum wage rises for all businesses at once, they're all able to sort of do it together.
So I guess I do have a follow-up question. You mentioned Walmart, and I think McDonald's, made news recently that they were going to be increasing wages for some of their workers, and then on further analysis, it looked like it would amount to about maybe 10% of their workers. Now, can you help us make more sense of that? Are these the kinds of efforts that we should be giving these guys a pat on the back, or I think you were mentioning this before that they could be doing more with the help of the federal government, but is this the kind of stuff that deserves some credit?
So I think they absolutely deserve credit, and we shouldn't take away from the fact that these kinds of actions by low wage employers are positive developments. We mentioned Walmart, but we should say for your listeners, they recently announced that starting this month, actually, no worker will earn less than $9 an hour, and by 2016, all workers who have passed a 6-month training period, is what they said, will be paid at least $10 an hour. And so definitely, something that is a positive development. That being said, we should keep in perspective that $9 an hour is still almost a poverty wage. A single parent with one child who's working full-time year-round would earn only $500 more than the poverty level in this country.
Wow.
And a related problem is that, even even as Walmart is taking action to improve their amount that they're paying their workers, even modestly, they have a persistent problem, which they say they're going to be addressing, although I think the proof will be in the pudding, about their workers not receiving enough hours, and also being subject to really unpredictable and kind of ever-fluctuating work schedules, which can also hamper their ability to take home a reliable and a livable paycheck at the end of the week. But, at the end of the day, much as these are positive developments, these actions by individual corporations, we just need to not kid ourselves. They're not a substitute for action by Congress to increase the minimum wage.
And so I guess follow up on that, I guess it's still worth it for these thousands of fast food workers to take to the protest streets of demanding a fight for 15.
Absolutely, and it's been just tremendous to watch, what attention that's received, and also, I think people have asked, why did Walmart raise its wages? Why did they decide to do this? And I think it's hard to know exactly why, but it's hard to say that it had nothing to do with how much significant flack they were taking in the media, largely driven by these really successful protests. So, action, local action that spreads in the way that we've seen these fast food strikes can really have a real impact.
And, I'm actually kind of curious to wander deeper into those wonkier waters of economics and business, because I've heard some people oppose increasing the minimum wage because, they're worried that prices will increase for consumers. Others are saying it's going to be devastating for smaller businesses because, especially if, like you were pointing out, if larger businesses increase their wages, but, smaller ones don't. About on any of that, increase prices for consumers, anything like that. Is there any truth to any of that?
So there's actually a lot of research that asks these very questions, and they're really important questions to ask because I think those are the most frequent myths that you hear out there, and also certainly the most frequent reasons you hear cited when people oppose raising the minimum wage. But the best research that we have indicates that that increases in the minimum wage boost earnings for workers without resulting in significant job loss. That's one of the myths out there. We don't see firms downsizing or going out of business. Instead, we actually see businesses largely absorbing the minimum wage increases through increased worker productivity, and this is important, reductions in employee turnover. And now turnover is really important because the hiring process, searching for new workers, screening them, training them, onboarding them, that's really costly for employers. And the typical cost of turnover for low-wage positions is actually as much as 16% of an employee's annual salary. So that's a big deal when they can realize those savings through reduced turnover when they raise their wages. But you also asked about price effects, and I think this is an important one as well to sort of nip in the bud and know the facts. The reality, when you actually look at the research on this, is that not only are price increases incredibly small resulting from raising wages, but they're really pretty much concentrated in the restaurant industry, which is the heaviest user of minimum wage workers. And so for every dollar increase in the minimum wage, you'll see restaurant prices rise by 7 cents.
Oh, wow. So
really, really small.
Yeah, that's like a nickel and 2 pennies.
It's precisely.
It's the change that you're losing in your sofa.
Quite literally. I think I have more change in my sofa than that, and I recently moved. So when you look at like specific examples of this, take a look at San Francisco, right, which estimated that even if they were to raise their minimum wage to $15, restaurant prices would only experience a one-time increase of just over 2.7% by the time the law was fully implemented. So break that down, that would mean a $10 meal would increase by 27 cents, and that would be a one-time increase, right? So this is really something that gets a lot more play, I think, than the facts really bear out.
Interesting. So, so far, I think we've made the case that it's, good economic sense, it's good business sense. I made the point earlier that it actually saves lives and, so it's, pretty good health sense. But so far, that's really, those are benefits that have been kind of more, I guess, like closely kind of applied to employers and employees. How about the rest of us? Like, suppose we increase the working poor's, wages to a living wage. Like, what's in it for the rest of us who are, not relying on that wage? Like, I mean, how do people with higher incomes benefit when lower income people, see an increase in their take-home pay?
I'm really glad that you asked that because I think that doesn't get talked about enough. I think there's this sort of conventional wisdom that when we talk about minimum wage workers and raising the minimum wage, we're only talking about some, segment of the population that isn't me, right? Which is, I think, how a lot of people who aren't minimum wage workers think about it. The reality is that the positive effects of raising the minimum wage go far, far beyond just the minimum wage workers who see a raise and their families. So for starters, raising the minimum wage actually has spillover effects up the wage distribution. So to translate that basically means that workers who earn $1 or even several dollars more than the minimum wage will actually see a boost in their wages too. And another piece of evidence here that should cause all of us really, out of selfishness, to want to raise the minimum wage is that higher minimum wages actually lead to boosts in states' economies. So, if you're a low-wage worker and you see an extra bump in your paycheck, even a small one, you're going to end up spending most of it really quickly because you're spending most of your money on basic needs, your rent, your food,
childcare,
exactly. And so what that ends up doing is boosting local economies and increasing overall local economic activity, and that helps all of us who participate in and benefit from the economy. And then the third point that I'll make is that actually taxpayers will save significant money when we give struggling workers a raise too, because our minimum wage in this country is currently so low that many minimum wage workers end up having to rely on public assistance programs just to make ends meet. So CAP actually did a study last year finding that if we were to raise the minimum wage to $10.10, we would save $46 billion over 10 years in our food stamp program.
Wow. I'm so glad that we're getting to have this conversation and really kind of tie these things together to, to sort of show this web of mutuality that, the minimum wage can ignite and, and reinforce. And Rebecca, I really appreciate your voice in raising awareness on these kinds of issues, especially, around poverty and with your work on Talk Poverty Radio. And I understand that that's now moving to, the We Act family. So welcome to our Social Justice League.
Thank you. We're so excited to be joining you.
Yeah, and can you tell us more about this exciting development?
We're really excited about bringing Talk Poverty Radio to the We Act Radio Network. So my co-host, Tracy Ross, who is one of my colleagues here on the Center for American Progress's Poverty to Prosperity team, we are going to be hosting an hour-long show focused on poverty every Thursday at 4 here on We Act. And what we do each week is we bring on journalists, we bring on policy experts, we bring on policy makers, including elected officials, and most importantly, we bring on low-income individuals themselves who really are the true poverty experts. And we talk about what's going on in local communities, what are the solutions that we should be looking to dramatically reduce poverty, and also how does the media cover it, and is there anything we can do to really improve that by being actually high-quality poverty journalism ourselves.
That's fantastic. So that's, those are really like amazing conversations that I'm looking forward to seeing. And, I'd love to be a part of those wherever I can and help those endeavors along, from a health standpoint. So consider, Dr. America will always be available to you guys on Talk Poverty. I'm really excited for you guys to join the We Act Radio family.
Well, we're so glad to join. We feel like we're joining the cool kids club finally, and consider yourself the recipient of a standing invitation to be on Talk Poverty Radio.
Fantastic. Well, Rebecca, thank you so much for joining us on the show. And you know what, guys, that was a lot to take in, so I'm going to give you guys a little break, but you got to come right back to Dr. America here on the We Act Radio Network.
My name is Joe Thompson. I'm 29 years old and have a career that I love as a systems analyst. Career. It still sounds cool to say that word. I never could have gotten on this path without a college degree. And if the college me were here, he'd tell you.
I never would have gotten to college without big brothers, big sisters. I could have ended up anywhere, on the streets even. But college? Joe Thompson? Not likely. My big brother helped me out. He taught me I could do anything, at a time when a lot of people were saying just the opposite.
And to a 7-year-old, that means a lot. My big brother's name is Phil, and Phil is the reason that this 7-year-old grows up to be a systems analyst.
Whether you donate money or time, you're helping Big Brothers Big Sisters help a child, and that can last a lifetime. Start something today at bigbrothersbigsisters.org. Brought to you by Big Brothers Big Sisters and the Ad Council.
You're listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.
Welcome back to the Dr. America Show on the We Act Radio Network. I am your host, Dr. Sanjeev Sriram, and I want to do one more thanks to Rebecca Vallis for joining us on the program today for really clarifying, all the benefits that so many of us, whether we are making minimum wage or not, would actually stand to gain from an increase in the minimum wage to a living wage with some, dignity for our fellow Americans. So what I wanted to do on the next part of the program is actually kind of cover a couple of news bits that have been happening since our last broadcast. And one that probably maybe didn't get as much coverage, but I want to really, give a shout out to the Montana State Legislature. So what I'm really proud of you guys out in Montana for doing is that you made the right choice to expand Medicaid. And the reason why this is actually pretty important to me is that you did this despite being pushed and pushed and pushed by hardline conservatives outside of your state to resist expansion of the program. Montana has a legislature that is controlled by the GOP, the Republican Party, and despite the fact that expanding Medicaid and working with Obamacare has been kind of like a flagship issue for the Republican Party, despite all of that, Montana said no. We're going to go ahead and expand Medicaid under the Affordable Care Act and start giving health insurance to people making, those poverty wages that we were talking about before. It's a big deal. It actually means a lot for the dignity of health in, the state of Montana. And what I think it actually can show is that we can get past our political identities and actually do right by our fellow Americans for their health care. And honestly, I'm really just excited and thrilled for the state of Montana for doing the right thing. And I'm really hoping that the pressure starts to build up for these other Republican-controlled legislatures to do the right thing. There's 22 states now that are refusing to expand Medicaid. There are all kinds of excuses about, how it's going to cost too much and all of that. But quite frankly, if Montana can do it and, show some, political integrity, I'm kind of expecting that the rest of you states will get it together, expand Medicaid, and let's get rid of this, coverage gap that we've talked about on this program before. So shout out to Montana. Thanks a lot, guys. All right, next piece of news I wanted to cover was obviously Miss Hillary Clinton is joining the presidential candidate pool. And I know that I've been pretty hard on other candidates from the Republican Party like Ted Cruz, Senator Rand Paul, And I'm sure I'm eventually going to be hard on Marco Rubio also. And, I just want Mrs. Clinton to know that, she can expect that I'll be tougher on her than I plan to be on those Republicans. And the big reason why is because, well, your family has to be tougher on you than your opposition because they are going to have bigger expectations. They're the ones who, you're going to lean on, people like me, people who listen to this program, to stump for you. You're going to need them on the ground doing the hard work of persuading the undecided to, get up and vote. We're going to be relying on people on the ground to, knock on doors and persuade the apathetic, to persuade the cynical to come out and cast a ballot for you, to wait in line, despite whatever weather it might be, and to cast a ballot for you, Mrs. Clinton. And, I saw that little video of yours, and quite frankly, I didn't know whether you were trying to sell me health insurance or life insurance when the video started, and then finally, you came out and said that you were interested in running for president, and then it was a lot of interesting follow-up about how you wanted to earn my vote. That's interesting, you want to earn my vote. Well, the next piece of news that came out after she announced her candidacy was some projections about the Clinton campaign is going to probably end up raising about $2.5 billion in the next election cycle. The 2016 presidential election cycle on one party, one candidate, is looking to raise $2.5 billion. Now, to be fair, President Obama, raised $1.1 billion in the 2012 election. And I guess my concern with a lot of that is, if we are, we've been talking about poverty on this program for a couple of episodes now. And if we as a country can afford to put in $2.5 billion into one candidate for one election, then why on earth are we having these conversations about whether we can afford to do food stamps? Why are we having these conversations about can we afford to expand Medicaid, or can we even afford to do universal health care, a single payer system, Medicare for all? Every time we talk about food stamps, Medicaid, housing, it seems to always come back to these questions of can we afford to do this? But without a blink of an eye, we're talking about billion-dollar campaigns for presidential candidates. Mrs. Clinton, I know that you're not the only one raising this money. I know that the opposition is, raising their money as well. And these questions have to be answered and asked by everyone. But when you're asking me about, earning my vote, or when you're talking about earning my vote, I have to kind of wonder, are you going to do when you get into office, or if you get into office, will you do what you were elected to do, or are you going to do what you were paid to do? Because quite frankly, I can't imagine that, enough regular people are going to be making those multi-$1,000 campaign contributions. When you do the analysis of, President Obama's campaign contributions, there's tons of people who are giving $1 there, $5 there, $10 there, but then there's also those people who donated thousands of dollars. And I have to imagine that those are the people that you want to kind of make sure that you're satisfying them so that on the re-election campaign, they'll be right back, with that next donation. And so I have to kind of imagine that when those are the numbers that we're talking about, and when those are the forces and the issues at play, and when that's the playing field, where do we fit in? Where do, people like me who advocate for the poor, where do we fit in? Where do the poor fit in? And I have to wonder, as a country, if we're going to be spending billions of dollars on election cycles, how on earth do we keep coming back to these issues of cost when it comes to the, to the poorest of us among us? Are we really reminding those campaign donors, hey, you had thousands of dollars to donate to a political candidate. The next time, that tax bill comes along, rather than squeezing every loophole for what it's worth, or avoiding the taxes altogether and playing the risk of just, paying a fine when you don't want to pay your taxes, I kind of wonder, will you be willing to just chip in for your fellow American? Will you be willing to, say hey, if we keep the food stamp program alive, that keeps, kids with some pretty good nutrition for them to start off their school day, and it makes them a better student, a healthier student, and it gives them something to work towards. Maybe that's my civic duty to that child. Because it seems that you can afford to do some kind of a duty to a presidential candidate. And like I was saying before, this is not just limited to Mrs. Clinton. And I guess, I can be equally hard on the other side for this kind of behavior. But Mrs. Clinton, the thing about, your presidency, your candidacy, is that you're depending on progressives who are really kind of caught between, your Wall Street donors and the people that they're trying to advocate for, the people that they're trying to represent. And they just sort of want to know, when push comes to shove, when you really are going to be, struggling to get that campaign contribution, who are you going to remember during that conversation? Because it would be great. It would be fantastic if you could actually look at some of those multi-$1,000 donors in the eye and remind them, hey, you know what? I've got to tell you some hard truths about what you're contributing to in the budget, that you might have to pitch in a little bit more, that, these pet projects that don't really do a whole lot for the best of us and the rest of us are not really going to be a priority in the president's budget anymore. Those are going to be some tough conversations that you are in a great position to have, because, it's not like us who are, making the little donations. It's not like us who are not making any donations at all, but plan on voting. None of us get to have that kind of access. This is on you as a candidate, So I guess, the dollar question is kind of like an important one. The other question I've got is really about what are you going to do with the safe spaces that we've been building, over the last 8 years? Because let's face it, one of the interesting parts of your campaign ad was that you showed a gay couple walking together, hand in hand. I can't imagine that couple was going to be in your ad from 8 years ago. I can't imagine that, and the truth of the matter is, the reason why that couple is in your ad is because the LGBT community made this a safe issue for Democrats to talk about. They made it safe for, Democrat candidates to champion their issues. And I think it is important for, candidates to, protect those areas of, marriage equality and dignity. I think it's important for them to champion that. But let's not forget who created that safe space. It isn't the candidate. The candidate came to the space because it was already made safe. Similarly, when it comes to healthcare, I feel that President Obama burned a ton of political capital on the Affordable Care Act. And yeah, I don't think Democrats have done a great job of messaging on it, and I still don't think that we've done a great job as, liberals and activists and health justice seekers. I don't know whether we've done a great job of, making it clear to the people who need the Affordable Care Act the most what they stand to gain. That maybe is on us, but there's no denying the fact that we have slowly but surely built a safe space where Medicaid expansion is happening in places like Montana. We're having millions of people get their health insurance, but there is still this coverage gap. There are still immigrants who, have to wait years and years and years just to participate in any kind of government program to get some health care. And I'm wondering, Mrs. Clinton, we've built this safe space for you to defend. Are you going to defend it? Even better, are you going to expand it? Are you going to make it so that we don't even have to have conversations anymore about whether we can afford healthcare? Because, we just see it as a basic human right. It's not something that we debate about whether you're worthy of it, unworthy of it, deserving, undeserving. Are you willing to actually go to those grounds of shutting down the debate over are we going to do this and get into how are we going to do it? How are we going to make it fast? How are we going to make it affordable? And how are we going to make it accessible to the people who need it the most? Because quite frankly, those are the frontiers that we really need some progressive leadership. And I am going to be tougher on you, Mrs. Clinton, because, this pressure is on you. We already know how the opposition feels about all of that. Ted Cruz wants to repeal Obamacare, doesn't care about the 11 million that have gotten their health insurance through the Affordable Care Act. Rand Paul says that his, alternative to the Affordable Care Act is freedom. We've talked about that on the show before, where he really thinks that people should just have freedom instead of health insurance, and somehow that will get them the health care that they need. Marco Rubio, not a whole lot better. So, we know that the opposition has no interest in the next frontier of healthcare and public health and health justice. But if you want me and any of us to really rally for you, to get out there in bad weather, in tough times, and gain the support of the apathetic and the cynical, then I got to know what I'm fighting for on your behalf. I think that that's something that, a lot of us who are, doubtful, not necessarily cynical, but doubtful, skeptical, they want to hear this. They want to kind of see what you've got to offer. That, if as much as we fight for you, are you going to be fighting for us? Tough questions. I don't really have easy answers for you, Mrs. Clinton, but I'm hoping that, that you've got something up your sleeve. I'm hoping that between now and Election Day in November and all these primaries that go in between, I'm hoping that we start to see something that we can fight for. Because quite frankly, I feel like you're entering some spaces that have been already done for you the tough way by regular people who stood nothing to gain as far as $1,000 campaign contributions or any kind of business access. These are people who really fought for their dignity and had not a whole lot to go on, but won it in some ways and are still struggling to get it in other places. And Mrs. Clinton, I'm hoping that you see that struggle and that you champion it and that you take it to the next level. So, okay, so we've talked about Montana Medicaid. We've talked about Mrs. Clinton entering the presidential candidacy, and and we've been talking about minimum wage on the program. So I want to kind of cover some other things that happened in the news this week, but I want to give you guys a break also. So you've been listening to the Dr. America show here on the We Act Radio Network. I'm your host, Dr. Sanjeev Sriram, and we'll be right back.
You're listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.
Welcome back to the Dr. America show here on the We Act Radio Network. I am your host, Dr. Sanjeev Sriram. Thanks for coming back. So I just wanted to wrap up with you guys with a couple of important news items. One is that there is going to be the Green Festival Expo that's going to be happening in a whole bunch of cities across the country. If you're in the New York area, it's going to be April 24th, 25th, and 26th at the Javits Convention Center. Here in Washington, D.C., it's going to be June 5th, 6th, and 7th at the DC Convention Center. And you can learn more at greenfestivals.org. It looks like this is going to be a fascinating opportunity to learn more about sustainable living, green living. They're going to be covering a whole lot of different things about how you can shop to promote, green and eco-friendly, products. You're going to be getting a chance to learn more about, food and nutrition options. And it looks like it's going to be a really good event. I am happy to plug this. So check out greenfestivals.org and learn more. So anyway, one of the things I was surprised to learn about is that April is a major health awareness month. When you actually Google April Health Awareness Month, you get about 13 different health topics that these advocates are trying to raise awareness around and action around for the month of April. And 13 is a lot to cover in this segment of the program. So what I'm going to try to do is I'm going to start with these three, and hopefully I'll be able to come back to this issue on our next couple of broadcasts this April. But the three I wanted to talk to you guys about today are the Health Awareness Month. When it comes to Health Awareness Month for April is STI, that is Sexually Transmitted Infection Awareness Month. it is National Child Abuse Prevention Month, and it is also National Minority Health Month. So I wanted to kind of cover each of those and let you guys know about, some facts that you can use, but also this is some news you can use to keep yourself and your loved ones healthier. So let's start with the Sexually Transmitted Illness Awareness Month. Okay, so to let you guys know, when it comes to STDs, this is like probably one of the most preventable diseases and situations that we have going on in this country. And so from Dr. America, I don't really like giving a ton of health advice on this show, but when it comes to your individual health, the top 3 things that I would recommend doing is use a condom every time you are having sex, unless you really do want to get a partner pregnant, in which case obviously you can't really do that with a condom, but use a condom. It's one of the best ways. It's a known, proven way of preventing yourself from catching an STD. Get tested for those STDs. That's my second recommendation. And the third one is actually to get your HPV vaccine. You guys know how I feel about vaccines. I'm a strong proponent of them, but I'm actually a really big fan of the HPV vaccine because this is one of the few vaccines that we got that stops the human papilloma virus, which is known to cause cervical cancer. And this particular vaccine stops a huge number of those viral strains that are the biggest troublemakers for cervical cancer, penile cancer, penis warts. And the fact that we have a vaccine to stop those terrible, terrible diseases is a huge big deal. So go and get your HPV vaccine and talk to your doctor about that because, there's no sense in, risking, getting cancer if you can prevent it. So for Sexually Transmitted Illness Awareness Month, my Dr. America advice is use a condom, get tested, and get your HPV vaccine. Okay. The next health awareness month that I want to cover is National Child Abuse Awareness and Prevention Month. And the reason why, obviously this is important to me because I'm a pediatrician and I feel that I'm really glad that we have some awareness that's building around this issue because according to Child Protective Service agencies in our country, about 679,000 children experience some form of maltreatment, and that's just in 2013 alone. And, when you look at the self-reported data, it consistently shows that 1 in 10 children and youth experience at least one form of child maltreatment in just a year. And more than 1,400 children, that's 1,400 children die in the United States, because of abuse and neglect. And so, this means, this is something that, we are supposed to be a moral society, and this is not the kind of thing that we should be seeing our children die from. And, I'm glad that we've got Child Abuse and Awareness Prevention Month to remind us that there are different forms of abuse. We've got, physical abuse, sexual abuse, emotional abuse. And, when it comes to, and there is neglect, that's, failure to meet a child's basic needs. And, and those needs include, housing, food, clothing, education, healthcare. And, I think that it's important to kind of remember that these issues do not happen in a vacuum. It's very easy, for a lot of us to look at child abuse and say, well, that's a bad parent or, that's just a very troubled family and treat it as an isolated problem. But, a lot of these problems exist in a context. And so that's why I'm glad that they actually include the notion that child abuse can be prevented. It is a preventable, it's an entirely preventable condition and situation. And, there's a lot to learn. I've actually, been, learning a lot from the Essentials for Parenting report that is it's a resource that the CDC developed, and it's called Essentials for Parenting Toddlers and Preschoolers. It's available online. I highly recommend that you guys check it out because it actually has evidence-based, information for how to, how to parent, children who can be very difficult. And, I'm not saying that every child is an angel out there, but at the same time, no child deserves to be abused or neglected, for just, a misunderstanding of their cognitive development or maybe their speech development or, maybe just like being a kid. And I'm glad that that the CDC has this Essentials for Parenting Toddlers and Preschoolers. I found it pretty easy to understand, but I think that it's worth all of us taking a look at it. And it might be the kind of it might be the thing that saves a child's life. So definitely check that out. And also, I kind of want to help remind folks that, a lot of the issues that we've been covering in this program, when it comes to, helping families with housing security, helping them with a living wage, helping them, with food security, with access to affordable health care, these are the kinds of things that build, peace of mind for families, so that when stress comes along, it isn't the child who gets, who is suffering for these kinds of stresses. So again, child abuse is completely, it's totally preventable. It's something that that we owe it to each other to do as much as we possibly can to prevent children from dying from child abuse and neglect, because it's just a tragedy that is unbecoming of our deepest values as Americans. So okay, so far we've covered Sexually Transmitted Illness Awareness Prevention Month, Child Abuse Awareness Prevention Month, and the one that I want to kind of go off on now is Minority Health Awareness Month. So when it comes to minority health, I think that we've covered a lot in this program about how there are health disparities in this country, that, inequities in healthcare actually do, show that our, most, important values as a country when it comes to, justice and liberty for all, that these are actually undermined when we fail to do, the basic health homework for our fellow Americans. And, unfortunately, we still see a huge number of health burdens falling on the backs of communities of color. And this is true when we are looking at states that fail to expand Medicaid. We're seeing this to be the truth when we have arguments about birth control being available to families. It's communities of color that really suffer from, lacking access to things like birth control. When we look at how drugs are priced in this country, it's communities of color that really struggle to afford their medications. So to deal with these issues, the Department of Health and Human Services has an Office of Minority Health, and they started a National Minority Health Awareness Month. And so and this was based off of the Heckler Report, which was published in 1985, and it was it was started by Health and Human Services Secretary Margaret M. Heckler, who determined that we have to kind of get cracking on why there are it's sort of and it was that there was more deaths happening in minority communities than were happening in white communities. And Secretary Heckler at the time wanted to get to the bottom of that. Why are there these health inequities, and what can be done about them? And so the Heckler Report was published that was looking into those questions, and then to kind of actually start working on solutions for what we could do. And, when you look at, how much progress that we've made, it's because of things like, the CHIP program, which reduced, the lack of health insurance among our children. And now when we look at CHIP and we look at Medicaid, they are the leading providers of health insurance for minority children. They cover overwhelming majorities of both Latino and African American kids. When you look at the Affordable Care Act, as we've covered before on this program, it's done wonders for reducing the lack of insurance among Black and Latino populations. And this every April we have an opportunity to kind of assess the progress that's been made, but also to look at where do we need to go next. And so as you all know, I'm a big champion of expanding Medicaid. I believe in it wholeheartedly, simply because it does actually build health equity and justice for all. And it's something that, that we can not only celebrate, but we can continue to work on. So that's Minority Health Awareness Month. So, happy to cover those three for you guys. I know that this has been a program with a lot of information to cover, but just to sort of help recap, because I think that, anytime we have an episode where there's this much dense information, I think it's important to kind of have okay, what are the big takeaways? What are the kinds of things that I need to do right now? So, the big takeaways for today's program, we covered minimum wage. I think it's important to pay attention to the hashtag Fight for 15 if you're on Twitter and get involved. Sign those petitions, write to your members of Congress, and really start learning more about how minimum wage can not only benefit, those workers that you see out there on the protest line, but how it can actually benefit all of us. I really thank Rebecca Vallis for showing us that. The other issues that we covered today were Mrs. Clinton is entering the presidential election for 2016. I think this is, again, another opportunity to ask those tough questions and to participate in the primary process to really get into who is she president for? Who is she seeking to be the president of? It's the kind of question that we should be asking every candidate, not just Mrs. Clinton, but we need to kind of start asking some of these tougher questions of, if we have, billions of dollars to spend in an election cycle, why do we still struggle to, afford healthcare for all, food, housing, and a livable wage for our fellow Americans? If we have billions to spend on, individual candidates, then why can't we do the same, for our fellow Americans who are, just wanting to get by? They're not looking for lifestyles of the rich and famous. They just want to get by. So, so we covered, minimum wage, we covered, the presidential politics, and then we covered, our health awareness prevention month. So with that, again, we've got, the sexually transmitted illness awareness month and, Dr. America's advice: wear a condom, get tested, get your HPV vaccine. We covered child abuse prevention and awareness month. What's important to remember about this child abuse is not just some inevitable tragedy that is, bound to happen to some kids. It should never happen to any child. There are ways of preventing it. It's worth visiting the CDC's website and check out the report, Essentials for Parenting Toddlers and Babies. Okay, and then finally we covered the National Minority Health Awareness Month, and this program I think has covered these issues multiple times. But again, remind your elected officials how much Medicaid expansion would mean in your state if your state has not expanded Medicaid. If your state has, then it's worth actually doing the next follow-up step of asking, your state health department, of checking in with your state legislatures on, have they done enough outreach? Have they gone out to the communities that really need to know about their health rights? And what are they doing to actually get their, our fellow Americans insured? Because honestly, there's only so much that, that Congress and the federal government can do before finally we need to kind of see how these things are playing out in communities. And that's where the rubber meets the road. So lots to cover this program. I thank you all very much for joining us. And next week, we'll be covering some more Health Awareness Month issues for the month of April. Definitely tune in. You've been listening to the Dr. America Show here on the We Act Radio Network. I am your host, Dr. Sanjeev Sriram. And until next week, salud to your health.
You're listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.
This entire piece of music was played with only two instruments, a right hand and a left hand. Hands can do incredible things, but nothing compares to using them to help save a life with hands-only CPR. If an adult suddenly collapses, call 911, then push hard and fast in the center of their chest until help arrives. Hands-only CPR is recommended by the American Heart Association and it's incredibly easy and effective. Find out more about this latest method of CPR at handsonlycpr.org. The power to help save a life is in your hands. A message from the American Heart Association and the Ad Council.
Hello, my name is Jim Gray, and I am a judge of the Superior Court in California and a former federal prosecutor in Los Angeles. I would like to talk to you for a moment about marijuana. Did you know that since the federal government first banned marijuana in 1937, usage in this country has actually gone up by about 4,000%? Or did you know that in the Netherlands, where adults are allowed to possess small amounts of marijuana and buy it from government-regulated businesses, fewer adults and fewer teenagers smoke marijuana than here in our country? Or that an American is arrested on marijuana charges every 38 seconds? If you are wondering if any of this makes sense, you are not alone. To find out more, contact the Marijuana Policy Project at 1-877-JOIN-MPP or visit them on the web at mpp.org. Thank you, and good luck to us all.